Pose that question to Dr. Aditi Nerurkar, who is with the Harvard Medical School. Good morning, doctor. It's Antonio Milton out of Chicago who wants to know why there isn't a cure being developed for COVID. Good morning.
Good morning, Robin. So, Antonio, that is a great question, and researchers are currently working on a cure, but it is years away. One of the biggest reasons why we don't currently have a cure for COVID is because COVID is a virus. It is the same reason that we don't have a cure for the common cold or the flu. Viruses mutate, and that's a natural inclination of a virus. So that is why we encourage vaccinations now, because we do not have a cure as yet.
Okay. So Liz Sembrana out of New Mexico says, why do we need a booster if the first vaccines are letting new exposures break through?
We need a booster now, Liz, because we believe that the antibody levels of the vaccinations from the start back 8 months ago are slowly declining. Vaccination protects us 95% against severe illness, hospitalization, and death. We are starting to see those numbers go down. The COVID vaccine provides effective immunity, meaning it protects against these very serious metrics. It does not provide sterilizing immunity, which would prevent infection in the first place. That is why boosters are so critical for us right now.
Okay, now Gwen Bradfield asks, every virus mutates, as we've learned from the seasonal flu, but COVID-19 seems to have stuck on Delta. Why?
You know, Robin, what we are seeing is that right now Delta has the stronghold, but what we also anticipate is that there are more variants down the pike, Delta Plus, Lambda, and a new variant of interest, B1621. This is why vaccination is so important. We know when we vaccinate large numbers of people, we then decrease the risk of new variants.
Okay. Jen Smith out of Morris, New York says, how are doctors and scientists determining that it is the Delta variant that's being contracted? But can you tell that when someone has a positive test?
You know, we are using something, Jen, called genomic sequencing to determine this. And what we do is that we study a small number of people and we test their sequence. That is how we know that it is the Delta variant, and then we extrapolate this to the larger population. We are having a new center at the CDC to help do this called the Forecasting Center, which can then build better models.
Our viewers asked some good questions, didn't they, Doctor?
They did. These were wonderful questions, Robin.
Thank you for helping us on them. Appreciate it. Dr. Aditi Nerurkar out of Harvard.